This is part 2 of Fair Drug Prices for Ontario, a closer look at the government's plan. Myth. The Ontario Liberals say they estimate that the proposed cuts to pharmacies will save Ontario over $500 million annually. The fact is, with reduced hours and more wait times and less funding, pharmacists will no longer be able to answer phone calls regarding medical and drug-related questions. Patients will call telehealth instead, which may seem not to cost you anything, but in reality, taxpayers pay $39 per call. So let's make a calculation. In an 8-hour shift, a pharmacist receives a minimum of 10 phone calls regarding medical or drug-related questions. The average pharmacy is open anywhere from 10 to 16 hours a day, so this is a conservative estimate. Calling telehealth instead, that's $39 per call times 10 calls, that's $390. Multiplied by the number of community pharmacies in Ontario which will no longer be providing this service, times 360 days, and we're already at $500 million in deficit because of these proposed cuts. What about walk-in questions at the pharmacy? In an 8-hour shift, a pharmacist speaks to an even greater number of walk-in patients than phone calls. But let's use a conservative number. Let's use 10 patients again. The best case scenario is all walk-in patients get diverted to telehealth, which is an additional $500 million. So the grand total for all patients diverted to telehealth in 1 year is almost $1 billion. Here's an example of how a pharmacist helps save the taxpayer money. One pharmacist writes, "Recently, an elderly lady called me just before store closing to ask if it was okay to take ibuprofen with another med, and she began spelling it. I stopped her halfway and said yes. She said, 'How did you know? I didn't even finish spelling it. I just spent 20 minutes with telehealth, and they couldn't find information on this prescription anywhere.' I told her to call me first next time. No $39 per call charge to taxpayers either." The fact is, there are other scenarios. Patients may get diverted to emergency rooms instead, and we all know that that costs taxpayers a lot more money. But more importantly, how long are you willing to wait in the emergency room? 5 hours? 8 hours? 10 hours? For an incident that could have been managed in a pharmacy? If you'd like an example of how pharmacists help patients every day, go to this link here. The patient in this article shares her heartwarming story, and you understand what she means when she says, "I owe my life to Sam," Sam being her neighborhood pharmacist. I hope that Sam and many pharmacists like Sam all over Ontario will still be there in a year, but if these proposed cuts go through, they may not. So what do pharmacists want? Pharmacists want a fair fee to replace professional allowances because right now, only professional allowances subsidize the following services. Whenever a patient goes to the pharmacy counter and asks to speak to a pharmacist regarding a recommendation for a cold, constipation, diarrhea, nausea, the list goes on. What about prescription-related questions? Sometimes a pharmacist spends 20 minutes searching resources to come up with solutions to manage cases, and for more complicated and rare cases, pharmacists call the Drug Information and Research Center, which pharmacies pay to subscribe to, but this is a free service to the patient. What about other services like compliance packaging for seniors and deliveries? Using professional allowances to pay for the wages of support staff, including cashiers, pharmacy technicians, and pharmacists, is not an abuse of funds like the government is trying to make you believe. In fact, they subsidize exactly what's needed for your pharmacist to be able to continue to provide these services. The fact is that pharmacies will have to reduce hours, cut jobs, and cut services to patients. But if you don't believe me, take a look at this article here. This article talks about what's going on currently in Ireland after pharmacy cuts, similar to the ones Ontario may face, were implemented last summer. Cutbacks to pharmacy last summer have already resulted in 1,600 jobs lost in the pharmacy sector. Union leaders blame the staff reductions on the cuts. 300 pharmacists and 1,300 support staff had been let go as firms were forced to reduce opening hours and provide fewer services to patients. So, as services were cut, some pharmacies even had to stop providing free delivery to their incapacitated patients. The next time the government claims that pharmacies are holding patients hostage, think again and look at this reality in Ireland right now. And all indicators are pointing to Ontario being hit harder than Ireland if these cuts go through. So to summarize, pharmacies will need to cut services and hours, many independents will close, and patients will be paying out of pocket for services that were previously free. Ontario's debt will increase while the government continues to list more and more brand name drugs because of their own confidential kickbacks with brand name Big Pharma. How much further into deficit will these proposed cuts take Ontario? 1 billion? 2 billion? Realistically, more than 3 billion? And we didn't even take into account the loss of jobs, which means less tax revenue and more unemployment. All this while services decrease and waiting lines get longer and Ontario citizens face more inconvenience and lower standard of care? McGuinty and his Liberals already squandered $1 billion for e-health, and they admit they were at fault. How much more deficit do they want Ontario to have? Why would McGuinty and his Liberals do this to Ontario? Dalton McGuinty knows full well that his odds of being re-elected in 2011 are not high. This is the classic final term pattern where a premier jams all the unpopular bills he can, since re-election is not a worry. In fact, it's advantageous to him to give the next government a ruined Ontario so that the new government will never be popular with the public. And a few years later, the Liberals will come into power again and pad their wallets and squander taxpayers' money even more. Talk to your MPP today and demand an explanation. In fact, I encourage you to watch these videos with your MPPs and demand an explanation for every single point, because you as Ontario citizens have the right to know why your government is trying to manipulate you and jeopardize Ontario's future. All pharmacists want is a fair fee to replace professional allowances that the government used and regulated to reimburse pharmacists so they would not have to. Pharmacists want an end to this, but removing the professional allowances before implementing a fair fee is negligence on the part of the government. Time is running out for Ontario. Talk to your MPP today. Go to stopcuts.ca to find out more.